Hello, everyone. Welcome to another episode of Psychiatric Times Psyched Perspectives. I'm your host, Dr. Frank Clark, and today I am joined by my guest, Dr. Lindsay Hill. She is a passionate and dedicated psychiatric mental health nurse practitioner and proud owner of Clear Care, a mental health practice that provides personalized and preventative care to enhance emotional well-being. Lindsay's journey in healthcare began when she earned her bachelor's of nursing from Cedarville University in Ohio. She then took a position as a community health nurse at Arizona State University Health Services, and there she had the privilege of learning from experienced faculty while she was there. Her interest in mental health nursing grew as she saw ASU students getting better with the appropriate psychiatric support and treatment. Lindsay saw a path forward, allowing her to help individuals with various mental health issues and support them throughout their healing journey. So without further ado, Dr. Hill, welcome to the video series, and it's good to meet you and meet you, I should say. I know we've been corresponding via text and LinkedIn for a while, so I'm glad to finally meet you.
Yeah, this is awesome, Dr. Clark. Thank you so much for having me on, and I'm excited.
Well, no, thank you, Dr. Hill. So I first I wanted to just get a sense from you, if you could talk to our audience. I'm a little biased because I'm married to a nurse practitioner, a psychiatric nurse practitioner. And so, I would love for you to talk about how you became interested in pursuing a career as a psychiatric nurse practitioner and what is bringing you joy these days as it relates to your practice.
Yeah, absolutely. So I was working as a community health nurse at Arizona State University, and there I had the privilege to work with a couple of very experienced psych NPs. And I had not enjoyed my psych rotation in Ohio. I kind of just thought psych, I don't think would be for me. And I got to see this other side of it where it was earlier intervention, more psychoeducation, and I saw that these students were actually getting better and learning the coping skills and getting the resources that they needed earlier. And I knew pretty quickly that that's what I wanted to do. I had personal experiences with friends and family over the years dealing with various mental health issues, and I knew I wanted to help that population, knowing that there was more options than just that inpatient unit that I had been in for my clinical in Ohio. So that was kind of what sparked my interest initially. And along the way, I really fell in love with precepting other psych NPs, learning from them learning from me. And when I opened my private practice about 3 years ago, I got on social media, and that has led to a lot of mentorship and consultation that I do now. And I'm really passionate about that. I had an hour meeting this morning with a psychiatric nurse practitioner in Georgia, and it's really those meetings that bring me so much joy right now in my practice. Just getting to give some of the advice and insight that I wish that I had had um, 10, almost 11 years ago when I graduated. So that's what I would say is really like what I love. And then I love my private practice that I'm able to take the time that I want to take with my patients and take an integrative approach and look more holistically and identify risk factors earlier to try to focus more on that preventative mental health. We go for that annual physical, but sometimes we put our mental health on the back burner, and so I like having this model of care in my private practice, and my patients really like it too. So that's kind of what led me into doing what I'm doing today.
Well, it sounds like you are obviously thriving and flourishing, which is a great thing, and I can hear it in your voice, the passion that you have for not only helping fellow psych NPs, but also really being a conduit for them, and in terms of allowing them to really get a sense of how they can thrive in their professional lives. And you said something I thought was very poignant of things that maybe you didn't get throughout your training or that maybe you wish you would have had. And so it sounds like what you're trying to do is pay it forward for the next generation of Psych NPs, which I think is important along the journey. Along
Exactly.
those lines of mentorship and sponsorship, I was curious. I know I've seen you post a lot on social media, and I appreciate your posts because they're very intriguing, but also, again, I can see the excitement, whether you're at a coffee shop or at home or at work. Tell us a little bit about the Psych NP Bootcamp because I don't think a lot of people are familiar with it, and I would love for you to share about how that came to fruition and just kind of give us a little bit of a snapshot of what that entails for NPs, especially Psych NPs, who are wanting to enhance their knowledge and further their growth and development in the field.
Absolutely. The Psych NP Bootcamp is a transition to practice program, and it came about because when I first got on social media and these Psych NP students and new Psych NPs were coming to me, DMing me, asking me questions, wanting to pay me hourly for consultations. And a lot of it I was just doing for free for fun initially because I had been so isolated in my telehealth practice that it just felt good to connect with people again across the United States. And it really was filling my cup. And I was like, I need to be doing more of this. And so I found myself on the calls answering a lot of the same questions. And I realized that it would make sense to scale it into a group coaching program and get it approved for continuing education so that people could have their employers reimburse for it potentially. Because what I was seeing is that these psych NPs were and are really struggling with that transition of wanting more support, wanting more mentorship. I remember what that was like, and it was intense. The pressure that I felt, like it really weighed me down, and I I wish that I had had more tools in my tool belt at that point. And that's kind of where my passion and my heart for it came about. And so a lot of it is focused on increasing clinical confidence, and we have like our prescriber's playbook that has engaging short videos that break down medications, pulling from Carlat and NEI and some of those great resources that we love that are evidence-based. And we have peer support groups, we have coaching calls, lecture styles, and a lot of people give us feedback that they're learning just so much in terms of the application piece, as well as the psychotherapy playbook. That was an area that I was really insecure about as a new grad, how that would fit into my practice. And so I actually focused my doctoral project on dialectical behavior therapy, but this also has allowed me to collaborate with other amazing providers like Dr. Carlat, like Dr. Debbie Granick. She's a psych NP who's really a thought leader in the brief psychotherapy space. And license some of their content and just create this platform and this community where people really feel supported and feel like it's safe to ask questions that they may feel they should already know about, maybe a cross titration or how to deal with side effects, just some of those practical things once they get into these settings, of knowing kind of what to do. I was very uncomfortable with how gray it all was when I graduated. I was like, just tell me what to do, and there was so much more autonomy that that made me very uncomfortable initially. So just kind of helping with those navigations and nuances is what I do in the boot camp now.
Well, it sounds like it has been something that has been helpful for a lot of people in the field. And, as you were talking, I couldn't help but think of some of the feedback that I've gotten when I've precepted NP students who are going into psychiatry. And one of the things that I've heard, and it sounds like this is maybe was true for you, is that the feedback that I've gotten is that they wish that there could be a redesign of their curriculum in a lot of ways, that there were some things missing during the time that they were pursuing that degree. And which brings me to my next question.
Mhm.
If you could be in a room with college or universities that offer Psych NP programs, what would you want to see in the curriculum that maybe you did not receive when you were going through your program?
Absolutely. I would have loved to see just more of the application piece of the content when it comes to psychopharmacology, when it comes to psychotherapy, just more of that like fly on the wall learning as far as how to actually do those things rather than, just like videos. I really just needed more like hand holding and more basics when it came to what to say to a patient, to a pediatric patient, to an adolescent. So I would say just additional resources. I didn't know about Dr. Carlat until like 5 years into my career, and his content is exceptional. I've actually, my alma mater, I've connected Dr. Carlat with and her, and they're now able to use his content for their students. And that's something I'm really passionate about too, is just where is this content that's easy, digestible for us to, as well as, I thankfully had the support with finding my clinical rotations and finding my preceptors, but that's another thing that I would want to bring up is really ensuring that we are vetting preceptors and making sure people are having quality experiences, I think is really important.
Have you been able to advocate for that, given that the spaces that you have been in throughout the years, and especially it sounds like you're somebody who really values the importance of collaboration and having the seat at the table. So I'm curious, have you been able to make some inroads there and advocate for what you have desired that the future psych MPs that are coming along get as it relates to their education?
I think I'm making some progress. I've definitely just reaching out to different NP programs because when I talked to Dr. Carlat, he was like, in psychiatry programs, a lot of them are using our content for free, and we would do the same with NP programs. And so just like knowing that, I spent a lot of time just reaching out to program directors and seeing if I could make connections that way, as well as encouraging the people, even in my boot camp, because some of them have been in the boot camp for a couple years now, to potentially precept, because I know for me how much that it really helped me with not burning out, with just enjoying what I was doing more. And so I think sometimes they need a little bit of a nudge. I know I did, to be like, I think you're confident enough to, would you be open to this? So that's another area where I just try to encourage people and then give them some skills as far as when they're looking for a rotation. A lot of people do have to pay for rotations now, how to kind of vet those options so that they are quality clinical experiences where they get to do the clinical interviewing and get feedback from preceptors. Because one of my rotations I had to interview for, and it was kind of intense. She was like, you need to be willing to do homework and whatnot. But I liked it because she really pushed me and gave me hard feedback. And I needed that. So,
No, I'm glad that you're doing what you're doing in terms of this boot camp, and I guess I'm always looking at maybe the 5 year plan. So strategically, where do you want this boot camp to go? How do you want it to grow?
yeah, that's a great question. I find that the people who are in the boot camp are asking me, and even not in the boot camp, but experienced psych NPs, in or not in the boot camp, asking me about help with diversifying their revenue streams, with maybe having a private practice, with maybe doing more on social media as a psychiatric nurse practitioner. And so I get a lot of purpose out of learning new things. And so one of the things that I did in the beginning of the year was a personal brand and digital income sprint. And that was something totally different. And I still haven't decided if it's something I'm going to continue to run. But usually that's kind of what I'm doing with the boot camp is responding to what they're asking me for. Can we have somebody guest speak on hormones and, somebody who's a menopause and a perimenopause expert. So I really try to respond to the needs of my community. But yeah, that's in 5 years, I would love to see it be utilized across, more for more people, maybe more on companies, enterprise level contracts where people are feeling like they just need more support for their psych NPs, and hopefully staying true to the needs of the community members and not losing my North Star, if you will.
Well, it sounds like your North Star is shining bright.
Yeah.
And I'm gonna maybe address the elephant in the room. I think whenever we hear about psych NPs working with psychiatrists, there can be some tension, I think, and the reason I want to address this because I think there's a common ground that we all share, and that is to help improve the well-being and quality of life of the patients that we serve. And I am of the opinion that all mental health professionals or just all healthcare professionals bring value to the table. And so I would love for you to maybe address the myths, the taboo topics, maybe as it relates to this relationship, because you've obviously worked with Dr. Carlett, who is well known. I subscribe to his um, newsletters and I really enjoy those. But you've obviously been someone who has been able to reach across the aisle and collaborate with psychiatrists. So talk to me about your experience with collaborating with psychiatrists, and how do you feel like we as psychiatric providers, whether it be psych NPs and psychiatrists and specifically, how do you think we could have more of a harmonious relationship versus I think sometimes society has a tendency, there's like this gravitational pull to kind of pit us against one another instead of us joining together.
Yeah, it reminds me of just the concept in dialectical behavior therapy where there's, so much polarization. And I remember working with adolescents and parents and adolescent, and it's like, where can we find a middle ground here? But, for me, I had the blessing to be in a place geographically, and where I was really supported by psychiatrists, and and so some of the stories I would hear when I started connecting with people in other states, I was like surprised by some of the cultures in the different states, and I didn't realize what a big rift there really was until I kind of got on social media and connected with more people. But I agree with you that I think even just more shared spaces, I would love to see more in-person shared spaces for these communities. I think it's really cool that there's been a push for more shared spaces with psychiatric PAs and NPs. I think that's another area where collaboration could be great. Mike Asbach is a psych PA who's been an amazing mentor to me, and we just met casually at a conference at the beginning of this year. And so I really think a safe space, uh, and it would be really cool if there was an in-person option, virtual too, but where people are welcome, psychiatrists, PAs, NPs, and there was that mutual, respect. Because I think it's possible. I think it's great to have psychiatrists like you, Dr. Clark, and Dr. Carlat, and psychiatrists who have supported psych NPs kind of from the beginning. That means a lot, a lot to us. And so I think, yeah, remembering we're on the same team and that it's not an us versus them situation because I see it on social media. Just saw it yesterday, like where a post of like a psychiatrist I follow and then a psych NP and like stitching about kind of like the controversy of people with their doctorate being called doctor, that those types of conversations. I actually did have that in my handle initially. I had Dr. Lindsay Hill underscore psych NP. And I ended up changing it because I found anytime I would go on TikTok live or anything like that, it would become all about that. And I go by Lindsay anyway with my patients, but I think we just need to keep like what matters at the center as far as patients' well-being and interest. Yeah, their best interest at heart, because there's not enough psychiatrists to provide all the mental health care and the needs that exist today. So that's what I would say. I don't know if I answered your question, but
No, you answered my question and very eloquently so. And I know that my wife has her doctorate and her DMP, and what I would say is you've earned that just as well as she's earned that. I know that there are different types of doctors, right? But you're still Dr. Hill, and I think what sometimes gets missed is the truth and transparency. And so, I like when I was looking at your website, you clearly state that you are a doctor of psychiatric nurse as a nurse practitioner. And I think sometimes what I have heard from the other side or the side that I'm not on either side, but in
yeah,
terms of the
yeah,
physicians that I work with, there can be this lack of transparency, which I think all of us could agree with can be quite dangerous if we are not stating our credentials and
absolutely.
what our degrees are in, what our expertise is, and what our background is. And so when I was reading on your website, I really appreciated that because you are staying true to who you are. But I think we would always, like, I'm not a surgeon. I would never, I can say I'm a physician, but I'm not going to misrepresent myself. And I think it's those conversations that we need to continue to be having that I think everybody could get on board with and find some common ground. So I'm sorry to hear about the exchange that you saw, but I think we need to be having more conversations such as these, which is also why I wanted to have you on the video series because I believe in making sure there is representation from everyone who is involved in mental health because I work with nurse practitioners in psych. I work with psych PAs. I've precepted psych PAs and NPs. And excuse me, I remember learning from a NP when I was in medical school who was a nurse practitioner in hematology and oncology, and I learned a lot. So again, we all bring value, and at the end of the day, we are human beings first and foremost, and then hopefully the goal is to add value to each other and come away with some common ground and respect for
Exactly.
each other.
Yeah, exactly. Approaching every situation with that intellectual humility of there's something that we can learn.
Absolutely. I have two more questions for you, and I appreciate your time for today. So you mentioned that you are really excited every day to do the work that you do.
Mhm.
I'm curious if there is one thing in 2026 that would be an area of growth for you that you would be maybe willing to share?
Yeah, absolutely. One area of growth for me would be I'm just continuing to work on showing myself grace. There's a certain pressure that exists when you start showing up on social media, or there can be if you put that pressure on yourself. And part of why I've set up my business and my life how I have is so I can be present with my kids and my husband and my family and so just staying true to that and prioritizing being present and not, when you work from home, the boundaries can kind of be tough with being on your phone and being on the computer, working late. So that would be an area that I want to work on. And yeah, just showing myself grace, not being quite as critical on myself as I can be sometimes when I don't meet an expectation that I've, set for myself. And so I think just being more comfortable with just being present and being mindful and not feeling like I have to constantly be, productive or accomplishing something, but that's enough, just being in the moment.
Sounds like what I'm hearing is that just remembering that you are enough.
Mhm.
And
Exactly.
I understand that wholeheartedly. So I think when we're able to show ourselves grace and it's embrace our authenticity,
Mhm.
that's where the real work begins and
Mhm.
having that self-compassion, which is important. But I'm glad that you're taking time to prioritize the things that are most important for you. And as a family man, I understand that as well. So
Yeah.
sometimes we can get so inundated and wrapped up in the things that we enjoy that
Right.
it almost can become like a mistress in some ways. So
Right. Right. Yeah. No, exactly. When you're passionate about it, it's like, yeah, you have to be really mindful and intentional in those moments where you're like, oh, I just want to keep researching this and whatnot. So,
yeah. So the last question I have for you, what would you say
mhm.
to the Psych NPs
Mhm.
that are currently in their program or going to pursue that degree? Three pieces or maybe three take-home points or words, pieces of wisdom that you could give to them that maybe you would give to yourself if you were in their
Mhm.
shoes again.
Absolutely. I think number one would be don't be afraid to be seen and start networking early. I think I was like wanting to hide out for so long, even at conferences. I don't know if I just didn't feel good enough or what what all went into it. But I really wish that earlier I had been more, or not even if I was comfortable, but pushing myself to be uncomfortable in those situations to just show up and meet other providers. So networking, I think, is really a huge one. I know it's like a buzzword. It can sound kind of annoying, but you really need that community in the work that we do. So I think the earlier you can start building authentic relationships with people, the more I think fulfilling your career will be. The other thing I would say is for Psych NP students to start taking care of themselves in school. And I know that's easier said than done. I dealt with a lot of depression when I was in school, and some of the things that I was doing before to take care of myself kind of fell off. And I wish that I could kind of go back and tell myself, like, you know, this is important for you to be outside and to go on this walk and like just allowing myself to take that time for some of the self-care that really kind of fills my cup. So I would encourage them to be intentional, always have something on the calendar to look forward to. I think that's important. And lastly, I would say get familiar with Dr. Carlat's resources. I'm a fangirl of Dr. Carlat. I love his resources. I wish I knew about him sooner. And he has a lot of free resources out there on YouTube, on his podcast. So I think it's a good way to start familiarizing yourself with different concepts, across mental health and psychiatry is with a lot of the free content that's available. So if you do 10,000 steps a day on a walking pad, you can turn a podcast on or something of that nature. So yeah, that's probably some of the top advice that I would give. Mhm.
Well, that resonates with me as someone who also went through their own depression when I was in medical school, and so I feel you on that in a lot of ways, and I'm a big proponent of relationships, networking, creativity,
Yes.
connectedness, really checking in on our neighbors and being human.
Yes. You bring up one last good point about like creativity. And I think, I remember having a project in school that was something where we were coloring like a mandala or something. And I remember being really like present and mindful and feeling like, wow, this is actually really helpful for my mental health. And I think I wish earlier I would have started having more creative outlets instead of labeling myself as just like not a creative person. And I think sometimes we can put ourselves in boxes, and I think we all have creativity within us. And I think that's another way not to burn out is kind of finding what that is. If it's learning how to knit, if it's photography, if it could be a lot of different things. But I think creativity, bringing that back to my career has really helped with that sense of purpose for sure.
Well, that is always music to my ears. As a poet, I refer to myself as a poet psychiatrist, not a psychiatrist poet, but a poet psychiatrist, and very intentional about that. So I'm glad that you are embracing your creativity because, as I've said when I've had other guests on, I do believe that the arts and humanities is what will heal us, not only our patients, but technically
Mhm.
we're all patients. So
Right.
will heal us from the inside out.
Yeah, absolutely. I thought it was super cool when I first learned who you were and what you do with children's books. And you wouldn't necessarily think that off the bat, like, oh, a psychiatrist also writing children's books. But it's like, it's super cool. And you can tell it's something you're really passionate about and you continue to like commit time to. And I think that's really important and special.
Intentionality is my word of 2026,
Yeah.
and it probably will be the word that I for the rest of my life. But especially in 2026, I think intentionality is important. And when we are intentional, like you said, we put it on a calendar. We have something to look forward to.
Mhm.
There's something that is very therapeutic about just being and not doing.
Exactly. Exactly.
So,
Well said.
well, Dr. Hill, it has been a pleasure to fellowship with you and to dialogue with you. Thank you for everything that you're doing in the mental health space, not only for your profession, but most importantly for your patients. And this has been another episode of Psych Perspectives. Peace and blessings to you all.